Immediate Clinic truly wants to stand above the rest. We want to shine.
Our facilities are new and high-tech.
We want it to be a comfortable experience. We want you to come in and to enjoy your time with us.
You know, at Immediate Clinic, we really do pride ourselves on, again, this great experience, and that starts from the second that you walk in the door.
With the Immediate Clinic signs going up, with our logos going up, people have noticed that, hey, something new is happening here. And we'll get people off the street who they'll come in and we address them like, hi, would you like to see a doctor? No, I just wanted to see what was happening in here. And we love that.
We pride ourselves on creating a great relationship with our patients and our community.
They come see us because they're comfortable with us. They had a good experience, they trust what was done, and they trust that if they come back, they're going to be well served again.
We have a small staff in each of our facilities where there's only 3 or 4 people that are working every single day that you can get to know and have a relationship with.
We like to bridge the gap between the primary care and the ER. So essentially, if you can't get in to see your regular primary care doctor, or if it takes a couple of weeks to get in and see him, we want to be there for you.
We want to be full service. You know, if there's somebody comes in, because with urgent care, it could be anywhere from a runny nose to a broken leg.
The advantage is you get somebody who, 1, is accessible. 2, also, I think what you'll be surprised to find is there's definitely a lot of compassion. We really want you to get better. It's not like we're trying to just see how many folks we can see in a day.
We have a lot of labs and diagnostic services on site so that we can give you the right treatment plan and get you back out quickly and for a lot less money than going to the ER.
We offer several services here. All of our centers offer similar services. So we do travel medicine, we do workman's comp, urgent care, so common bumps, bruises. We have x-ray on site, so any minor injuries, those kind of things we can do here as well. Minor procedures, outpatient, foreign body removals, those kind of things, in addition to a lab on site.
You can come in for a flu shot. You can come in for a physical for one of your kids and test us out. And it's not going to cost you much. A flu shot's 10, 15, 20 bucks. A school physical's in the same range. And you can actually have that experience without putting it on the calendar 9 weeks out.
So I think sometimes we go to see doctors, then we end up getting like $200, $300, or $500 bill. Sometimes we don't really know what that is. But for here, we tell patients how much it's going to cost you. Then they have an idea.
The great thing about coming into our urgent care centers is that you can walk in without an appointment and you can experience it at very low cost.
Urgent care centers, I think, are for patients who really want to see somebody now, who feel that they have a problem that is worrying them, that is concerning them or their family, and they want to get it evaluated and get a professional opinion about it, whether it's something that is serious, is not serious, can wait for treatment, or needs treatment now.
I take personally, the success of my staff and, the happiness of the patients that come in and out. Our goal is to help people, and if people are leaving here feeling like they didn't get what they deserved, then we're not doing our job. We want people to come in and feel like they're just walking into the living room, getting a little bit of consultation, and then heading home to where they feel comfortable.
Our goal is to call back patients 48 hours later to check in and see how they're doing and see if they feel better, or if they need to come in or follow up with their primary care provider. And we want to have that open dialogue so patients don't feel like once they leave the door, we're not thinking about them anymore.
When I'm here at my job, Immediate Clinic, I feel excited, happy, and at the end of the day, I feel so good that we were able to help all these people feel better, and they walk out the door feeling like they had somebody to talk to and somebody to help them through their issues and problems and their illnesses.
We're going to treat you like one of our own family. I mean, our goal is to come into your community and your neighborhood and be your local neighborhood walk-in clinic. I mean, that's who we are.
There's a service here out to meet your needs. If you ever have a minor medical emergency and you can't get to your primary care physician and you need to see a doctor right now, we're here for you. And for most of them, we're in walking distance. And if you have to get in a car, you can park out in front. But there's something here in your community. You don't have to drive all the way up to the hospital. You can walk, come in here, see a physician, and have your needs met and be taken care of.
We want to be that neighborhood type clinic that everybody comes to. The concept behind what we do in that we are open 7 days a week from 8 to 8, 365 days a year. We want to become a part of people's routine, you know, so that when they get up in the morning, it doesn't matter what day of the week it is, it doesn't matter what time, they just know that if it's between the hours of 8 and 8, we're going to be there.
My short pitch to you is, this is probably the nicest, most convenient environment you're going to find for small emergencies or quick care that you need. We call it immediate clinic because that's how you'll be seen.